Alrighty, everyone, we're going to bring this Health and Human Services meeting to order, April 14th, 2026. It is 3:45 p.m. We are recording, so be on your best behavior. And we are going to start today's committee meeting with a special presentation on the Wellness Hub. We have Ms. Cheryl Roberts from the Greenberger Foundation, Mr. Kevin O'Connor from RUPCO. Thank you both for joining us, and you have the floor, Cheryl.
Well, thank you so much. We really appreciate us giving us the time. And I have a short PowerPoint for you, and then I'm going to kind of rush the beginning of it just to give you some background for those who may not know. And then I'm going to turn it over to Kevin, really, who's going to talk about the program and where we are. So, I might need to, like, how do I don't think it goes with the There we go. Okay. So just as a reminder, this is, and I want to kind of set the record straight because I've heard folks refer to this program or this project as a Greenberger Center project, and it's really not. Although we've been deeply involved, it's a public-private partnership. We were asked to do the sequential intercept model mapping exercise in 2020 by former Mayor Kamal Johnson, and the county jumped right on board. They offered up their time and talent. Some of the folks are here: Dan Armasi, Bob Gibson, Kathy Eldridge was on Matt Morrell was on the intercept model mapping report. It took 18 months to write the report and then came out with recommendations, one of them being the Wellness Hub. And the Greenberger Center was asked to then step in and help through the implementation phase. We got through that phase, and then we were asked to help with development. And that's when we partnered with RUPCO at the suggestion of Dan Almasi, who raved about them. And I quickly understood why he was raving, because RUPCO has been an incredible partner. So just wanted to set the record straight that, or not set straight, but just remind folks that this is very much a public-private partnership. And it, oops, I'm so sorry. You know, and it's the Columbia County, City of Hudson, and Lieutenant Greenport has been, great, and Kathy Eldridge has been great, Supervisor Eldridge. And then not only RUPCO, but Gateway. Gateway has been awarded both operating and construction funding to operate a short-term temporary residential housing, which I'll tell you a little bit more in a moment, but those are our private partners. Oops. So just to remind you, this is the site. The original site was 4.8 acres that was donated by Paul Colarusso very generously to do the Wellness Hub. This was the original concept plan. Here is the permanent supportive housing, 35 units. The safe haven shelter or emergency shelter, it was originally 24. Now we're looking at 28. We'll talk about that in a moment. Here's the short-term temporary residential housing here. That will be run by Gateway. And then this is the Welcome Center. And I will tell you that it's not going to be this large. We're having a hard time getting funding for it. So we're probably going to shrink that. But this was the original concept, as you'll know, pre-January 1st, 2025. The last year, we've been really mired in a change in regulations. In January 1st, 2025, the DEC implemented new regulations on wetlands, and basically not the entire, but much of the site where you see marks were designated as wetland. So it presented quite a lot of problems for us. And so we had to take a year working with DEC and also working with Paul Colarusso, who gave us some additional land. This is additional land from Paul Colarusso, and Rick Cummings from Mulhorn Oil gave us this little parcel number 3. These are upland parcels, and it gave us the ability to stretch out the design and work within, we think, DEC's requirements. So this is the current concept plan. Here's the permanent supportive housing, the short-term temporary housing, the safe haven shelter, and the welcome center. And before I turn it over to Kevin, I'm just going to show you this is the rendering, which we're really happy about. You can see the buildings are now kind of more narrow and taller to avoid the wetlands. So this is the permanent housing here, short-term temporary housing, the shelter housing back here, and the welcome center, which again will be probably shrunken down. Just a word on the wetlands issue before we turn it over to Kevin. I don't think I mentioned this actually, but So last week, the wetlands regulations that we spent a year trying to work through were overturned. And because DEC didn't follow their own environmental regulations. So they were overturned, and we have a choice. Do we wait to see what happens, or do we just move forward? And I think the recommendation, I think, is going to be, let's just move forward, because we've already spent the year with DEC. We had good feedback from DEC. They're going to give us the permit, but we have to, jump through the hoops. The hoops are, we, like I said, shrunk the buildings, made them taller, worked around the wetlands. We're going to be planting native species. We're going to be controlling our stormwater. We're also doing a boardwalk, and you'll see some of that in a minute, to provide educational opportunities and recreational opportunities. So all of those things DEC was very happy about and understood the significance of this project from a public benefit perspective. There is something called a public benefit waiver in the DEC rules, and they felt that this fit within that because it's such an innovative project and desperately needed. So that's where we are. And I think, Kevin, I'm going to turn it over to you now. Let me just see. Oops. Oh, well, this is another rendition of it from a different angle. And then here's the boardwalk I was talking about, an a rendering of it. And now, there you go, Kevin.
Great. So maybe I'll start a little bit about Rupco and our experience and my experience before I get into looking at both the safe haven shelter and the layout, and then the permanent housing layout as well. I started in 1988 with Hudson River Housing in Poughkeepsie. And their project was Gannett House on Route 9, right next to the Duchess Golf and Country Club. They had bought a small budget hotel, 19 rooms, and it was an emergency shelter. When it came in 1988, they had opened it in 84. They just built a new dining facility so that they could really provide 3 meals a day. So at Gannett House, we had 19 rooms. We had in the back, the cottage was turned into a daycare center. We had case management, on-site daycare. We had 3 meals a day with some community space. We had transportation, housekeeping, and facilities. Counties have been placing people in hotels even before 1988, and still we do that today. There's some of the funding, I think requires that doesn't allow to create permanent housing, but back then the per diem rate was $55 per day, and the average length of stay was 13 months in shelter. That was a long time ago. Hudson River Housing went on to develop transitional housing for the homeless. We did a building on the Psych Center, the Hillcrest House. I've been in a lot of children's ward. Have been abandoned for many years. We did permanent housing and really built a strong supportive service team. In 2002, I came over to Rupco, and Rupco is this year celebrating its 45th anniversary. Our mission is to create homes, support people, and improve communities. We like to work with communities, not in communities. So, we are only here at the invitation of the Greenberger Center, and we love the fact that this work came about from the community and the work that was put into it over, several years actually, to develop a concept to respond to a need. And unfortunately, today, all of us and all of the Mid-Hudson counties are facing these issues. When I walked into Rupco in 2002, we were a staff of 15. We didn't really have a big supportive service footprint. Today, we're a staff of 120. And we have really moved well back into supportive housing, in addition to doing all kinds of housing. Housing is a big continuum, and we are all on it, and we don't stay in the same place. So, maybe sometimes we need some rental housing. We'd like to get into some starter homes, maybe move to a bigger home. Sometimes we'd like to sell that home, get back into a maintenance-free environment. There's workforce housing. We've developed housing for artists. We've done a lot of senior housing, now increasingly supportive housing, clearly a lot of multifamily, and anxious to do some more home ownership again as well. In terms of supportive housing, we've really we've had the Stuyvesant 40-unit former hotel in Kingston before I got there, and that has been supportive housing for seniors and people with disabilities. For a long time, Gateway was our partner there, and they had 12 lead apartments for people with developmental disabilities. And operational and in the capital, the Welcome Center is a little more challenging because the housing dollars won't necessarily pay for that. So we're open, and we're keeping the footprint. So we environmentally and through the planning process, we'd like to keep footprint there to make sure that we're fully studying the impacts. And if we have to scale back, we can, but we're not going in tiny and Dan?
I'd just like to add one thing to the staffing question. Kevin, correct me if I'm wrong, but what you just characterized is specific to what Rupco's managing. Gateway and the short-term transitional residents will bring additional FTEs. The state requires them to have quite a robust staffing model for short-term transitional residences. So Ryan Schneider from Gateway could probably speak with specificity to that. He's not here today.
I think the bottom line here is that this is not like a motel. This is not like any other, I think, facility that we have in the county. This is highly, at every level, whether it's emergency housing, permanent housing, or the short-term temporary housing. This is highly staffed and a managed, environment where we think it's going to have much better outcomes than what we're currently spending taxpayer money on.
And their program for funding.
Yeah.
What is the project estimated cost now? I know it's
The
been
construction,
pushed down a little bit, which,
like 30 million?
On the capital side?
Yeah.
To build it?
to build it.
So STTR has their own capital. We're sharing Architecture Plus. We have the same architect working from home.
Not holding you to it.
I have
too many,
A lot of numbers have been thrown
I
out.
think
I have too many projects out to pull up the budget.
That's nice. But we'll get you the number. How's that?
All right,
Yeah.
thank you.
I have to get back to the staffing. That's always been my
I know.
concern. It's always been, how many nurses, patient care assistants, techs, kitchen staff, who's going to, is there going to be med administration, or are they going to do their own? These are questions that I have about the staffing.
Yeah, so we'll have case management staff. We might have someone in the medical field. We'll see. Where it's difficult to hire nurses and nurses assistants. And we're not necessarily pledging to have that. I heard food service as well. Yeah, so we'll have professional food service to deliver 3 meals per day. Again, significant case management on site. And we're not doing clinical work on site. It's more of a referral process. But we hope to have other groups and nonprofits from the Mental Health Association and others that might come on site to provide a host of therapeutic processes and opportunities for people to meet both individually and in group.
So with this, because the case managers are out there, they wouldn't be RNs, they would be, the case managers wouldn't be RNs? They would
Yeah,
be
no,
nurses,
no,
okay.
generally not.
So the med would be done by trained med techs, or,
Yeah, people are gonna be, particularly permanent housing. This is independent living, and they could manage their own meds. We would not be
but the
managing.
acute,
That's, yeah, so that's Gateway, and they absolutely have
that's
to
for
have
the
that
severe, okay?
Yeah, that's different from Rupco, and Gateway will absolutely have their own staff.
Yeah.
Just want to delineate.
They've done this before, and they're bringing the staff with them.
I apologize. I can speak of
Thank you.
shelter permit.
Good question.
We're cognizant on the time for the funding from the county, as to when we have to pay that by and all of that.
Yeah, believe me, with all the money we've had to spend on lawyers and wetlands and this nonsense, and then this pipe, that was a problem we dealt with the pipe. There's no problem with the pipe for some of you who knew about that. But yeah, I think we're unfortunately, we'll have spent that before the time.
There's a deadline to spend.
Right, that's
There
right.
is the end of the year, yeah. Yeah, we'd hope to break ground by now, but this wetland thing just,
Right, no, I know.
So we're gonna hold you to 6 months.
Yeah.
Did I say so? I don't know. Maybe
Breaking ground
Sounds
will
like a
involve
deadline.
one shovelful, broken ground, right? So you.
we're all
shovel.
excited.
It could be helpful.
All right, terrific. Well, thank you both so much for the
Thank you.
presentation.
Yes.
Are there any further questions from the committee? Would our department heads like to opine at all?
I just want to say thank you to Sharon, Kevin, and everybody involved. It's really brings me joy that we're this close. I don't want to jinx it.
No.
So, yeah, hopefully groundbreaking, whatever, but groundbreaking. Yes, but of course.
I mean, we do have to go through the planning board, right, process. So, you know, that's, we're working, and we hope to be good partners with the, you know, Town of Greenport too, with their septic, with their treatment plant issues. You know, we want to be a good partner, and so, we're hoping to get through that as well. But that I think is where, I'm hoping 6 months, but I think that's where we have to kind of focus now.
Well, we've been involved in the Herculean effort already, and it looks like you've seen the horizon, right?
Yeah.
Terrific.
I didn't hear what you said.
You've been involved in the Herculean effort
Oh,
already.
yes.
You see the horizon.
Yeah, I-
All right.
Chairman, I'll just add this, because it sort of came up, and also our shuttle runs very close to there,
Yeah.
and I think could easily shift just a little bit and make its rounds through there. To Kevin's question, transportation is gonna be much better once you.
Terrific.
Thank you.
Well, we look forward to it. Thank you so much.
I know, but it's real. I mean, that's why we have, that's why we went with the meeting. Thank you so much. Kevin, should we take that?
Yes.
All right, everyone, we're gonna kick off our regular session, starting with Director Grandinetti. Come on up, sir. Youth Development.
Here we are, sir.
Thank you, Chairman. Couple updates. The SWIMS grant, we are still working with one town to get the MOU signed and delivered. We went through all the invoices that they wanted. We got them, and they sent back another note. They wanted MOUs as well. So just about done, and we'll be reimbursed. So that's been pretty, timely. Let's see, our 25-26 year programs are in play, running, working with the commissioner. We have the boxing program up and running. We have the Bindlestep Circus that will be back again for the summer. And we are in week 7 of the Brazos Dance program. Those things are doing well. May 20th is the banquet. We have a little more than, I think, 24 kids that are nominated throughout the county, and we're looking forward to it. You'll get the formal invitations relatively soon, probably next week, but we're looking forward to it. This is the 3rd year that we brought it back, and it is it's pretty time, and I can't thank Sherry enough. Frank's down here. She is just the organization of information has been very helpful, but we're on target. This year, our primary sponsor is the Galvin Foundation. So we will have the Galvin Foundation, of Erica's Insurance, and Social Services as well as helping out. But they became the primary funder.
Very nice. Any questions for Director Grandinetti? Thank you, sir.
Thanks.
Thank you, sir.
Thank you. Thank you.
Keep up the good work.
Okay, Commissioner Gibson, DSS.
Good afternoon. Just want to start with, my colleague is quite correct that MOUs, the state required MOUs, but what he forgot to tell you is who's doing all that work. Who's doing all that? Her name is Ann Delaney. Who's doing all that? I wanted to mention it.
Well, thank you.
Okay, so I have a request here to upgrade one senior account clerk position to a grade 11B base salary 48,111 to bookkeeper, and grade 12A base salary 51,000. Authorization to fill on June 15th, 2020.
Second. Further discussion. All in favor?
Aye.
Opposed? Carried.
And I request authorization to create and fill one bookkeeper position, grade 12A base salary. There was an emergency fill that the chairman and HR were kind enough to fill for us, so we could begin the process.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carries.
There are stats, timely to take a look at. I think, I was looking this morning over all of these with my income maintenance director. We're actually 7 to 10 percentage points ahead of the state average on opening, timely on all of these. And I think that's worth noting. The state average is actually somewhere in the mid-80s. And those of you still left on the board who went through some of these litigation know that was never good enough. Ours are where you need to be. So I just want to give a shout out. We are working with an incredibly thin staff, and they are working into the evenings and on Saturdays at times, but they're keeping it up, and I really owe them a great debt, and I feel like I need to say that.
To thank them on behalf of the committee.
Thank you. You'll know, and I've been talking to several people, homeless, while these are rather stark numbers, right? And if we had been looking at these numbers in 2016 and 2017, we would note just how stark they were. But those of you in this room who are looking at these numbers in 22 and 23 and 24 probably see the thinning out of it. I don't know if this is a trend, if this is a slow bounce back after COVID. I really don't know, but it's been several months where I've noticed that now. So, with today's presentation, with some of the Galvin still being out there, there's hope now that at some point we could keep this population not only down, but in the greater Hudson area, where there is transportation lines and you're not very far from the agency. So it's a very different place than we found ourselves as we went into COVID. So those are my comments on those.
I was gonna ask Bob while we're on that. I do understand there's future plans for the blue spruce up there. Is that going to affect you, do you think? Or,
No, we don't use the blue spruce
Okay.
and good on them. I mean, I think
Yeah.
that they would like to sort of upgrade and.
Yeah, that's what I'm hearing, but I thought that we were using that. for
We
some of
had
those.
been years back, but, tracking on that
yeah.
idea, and also I'd like to be even closer to the services than that. So, I
Great.
mean, we're
I didn't know
further
that we
in
were
some
using it
cases.
sometimes, so.
We were, yeah, I mean,
Every room is important to you, so
and that's still the case.
Right.
It's still the case. I mean, as I said, if we had looked at these numbers.
Yeah.
Even 8 years ago, we would be
Right.
a little bit alarmed. I'm saying, I'm looking through the lens of the last 36 months.
Right.
To say, well, okay, maybe there's a little.
Slow improvement.
in stuff.
Right.
And forgive me for getting last year's numbers, but how do we relate with our HEAP applications, winding down this winter, let's say?
Well, we had a great season. It's funny you should ask that. We were up in numbers, but the state, and I see Ms. West is here, so she might be able to speak a little bit to this as well, but because of the government shutdown, the way that HEAP got up this year actually gave lead up time for all the agencies to get ready on their applications, send it out, get the staffing ready. And it made the process much more timely. So my thought was, why don't you do that every year? And we're talking to Otada about that, like, let's at least learn from that. Because my staff is rating, we've never been able to get off the ground like that. When we had that 10 days to rev up, we were ready. Apps were out, our partners were ready to go. And we really just managed these things. So we had a great HEAP season as it turns out, and it was very organized. And so I've been lobbying OTDA, why don't we take a lesson from that? And give everybody a little time, including the community, because it's not easy to sign up. The applications are not very easy, as many of you already know. So it's great to see.
Great.
Okay, numbers were ticked up a bit, but that's to be expected.
Any further questions for Commissioner Gibson? All right, thank you, sir.
Thanks.
sir.
Director McGann. You looking at your watch?
No. No, not at all.
I know, I let the meetings, go along.
I got a 3-year-old ready to run around on a playground for me, so. Please excuse me. My first request is for authorization to fill a registered nurse due to retirement.
Move it.
Second.
Further discussion? All in favor? Opposed? Carried. Who do we have to thank for their service and,
So position has been, open for a while, so they left.
oh, the
last year.
retirement as well?
So, yeah, they're,
My mistake.
yeah. And,
That one, you got it already?
yes, we're hoping to upgrade one of our, LPNs that we hired who is taking her boards in a couple weeks.
Good.
Yeah. Authorization to upgrade one public health engineer, which is a vacant position.
Move it.
Second. Did anyone need a reminder? of
Further
that?
discussion?
Is there somebody in the wings?
I will say at the rate advertised, they weren't attracting
No, no.
anyone, so we agreed to an additional $5,000.
Has there been any,
No, nothing. Absolutely.
and is this this number will be advertised, correct?
Yes, yeah. The,
How is the, I'm sorry, when
Yes.
you finish that, and then I can ask a question, I can ask it now. What is the, how is it working out with these other, private entities that are taking on these? Is it working out okay?
things are moving. There's still a lot of issues. We're still coming across, it's a lot of cleanup. We're still coming across a lot of things that are coming out of the woodwork. People who held up plans for 20 years, with the new law, you do have to resubmit. And so it's just, some unpleasant conversations, but we're getting
With
through
the
it.
public or with these companies?
With the public.
Right, so are these companies though moving things pretty well, or?
Yes, yeah.
Okay.
A lot, the initial ones that we sent out, sent them out as they came in.
Right,
So we had a bit of a backlog. So the initial ones, a lot of them were, kind of, resubmissions. So they had engagement with our engineer ahead of time. So those were a little bit faster. Now we're getting into some of the first submissions. So if we're needing a little bit of attention. Still a lot of administrative support on our end, more than I was hoping for, but. I
So
think I
this-
was very
this-
just-
this, program we're doing, because we didn't hire anybody yet, it's not something we could do long-term, does it?
It's very expensive. We have.
Aside from the
increased-
cost, now, that's, I guess, my question.
Um,
How efficient is it? Forget the cost for a minute. Not efficient.
that's really hard. I would love to have more support, in our office
Okay.
for the admin.
My gosh,
All right.
All right, can I get a motion on that resolution?
right here.
Did I already?
That was the first one.
Boy,
I thought,
Matt
you
and
know,
Ron, sorry.
all in favor?
Aye.
Opposed? Carried.
A little technical glitch threw you off.
It's-
Second general.
I'm actually an avatar coming out.
Well, yeah, someday. Second general resolution is the contract with, CCPR, Columbia County Pathways to Recovery. We have supported them with rental assistance as well as some staffing assistance for a program supervisor to assist them in their operations. If you aren't familiar with CCPR, they're our one and only recovery center located in Chatham. They provide a meeting space for 12-step fellowship, community events that are related to addiction and recovery type topics and events. So we're supporting this.
All right, a motion, do I have a second?
I'll do the yes.
Further discussion? All in favor?
Aye.
Opposed? Carried. I think they're actually doing a housing seminar coming up.
Yeah.
Next few weeks.
Third general resolution, I can't believe it's been a year already, but I feel like I was presenting this not too long ago, Oxford House. So Oxford House, do I need to explain, is the recovery residence. The census is pretty good. We're near capacity. It's 8 beds, including the coordinator, so technically 7 beds. They're at 6 beds at the moment, so they need 1 more to be full. But that's pretty good.
Terrific news. All in favor?
Aye.
Opposed? Carried.
A year ago.
Yeah.
It literally seems like I was talking to you about
Not
too long ago.
Crazy.
And then lastly, I just ask for your support to extend the employee of the department, Glenn Valley. He's playing a pivotal role in processing medical records requests. You may remember you supported offering enhanced titles to 2 of the support staff to take on this. They're still in the training process, and they on occasion get pulled away to do other tasks because of people calling out and so on and so forth. So we need Glenn's help through the end of this year.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Thank you. Any questions? Appreciate your support, everybody. Thank you.
Thank you, Dan.
Enjoy the weather.
All right, and sitting in for Nina Benvenuto, we have Kate West. Come on up, Office of the Aging.
I don't have a lot.
Good, we have a lot of questions.
Oh, wonderful. I'll get back to you.
Good answer. Nina will call you, right?
Yes. I'll send her a text message right now.
Okay.
Okay, so we have 3 requests. One is CSA assistant position that's due to a retirement.
Move it. Second. Further discussion? All in favor?
Aye.
Opposed? Carried.
The second one is to extend our contract with the Greater Hudson Promise Neighborhood. They've been processing the payments for our heating assistance program when we got the unmet need money from the state. We have a couple pending. NYSOFA has extended us the unmet need money through September.
I'll move it.
I'm sorry, I just was curious, like, why this is in the middle of the meeting. It already expired, it looks like.
It expired
So-
the 31st.
Yeah,
We have a couple payments processing.
So in theory, like, but it's just like an assumption that it'll get that, which of
Well,
course I'm supporting.
The
but I was just
contract,
curious.
the contract does say in there for, to be extended.
Yeah,
And it- so it was written in there. It's just a formality.
yeah, okay, I'm just curious, it's my first week.
And I'm just doing what I was told.
Yeah, sometimes that happens.
Yeah.
They forget to renew on.
You only got to answer a few, I've seen it.
We have-
You have a motion, huh?
Yep, we have a second?
Did you raise your hand? Are you?
I know, I made a motion.
I got it.
You got it? All right, further discussion? All in favor?
Aye.
Opposed? Carried.
And the last thing is to accept a grant from the Bennington County
Move
Chair.
Just say grant, just say grant.
Free money.
All right, any further discussion on this one? Please, no, don't, please. Okay, all in favor?
Aye.
Opposed? Carried.
And those are just, the quarter 1 stats that Nina printed out, our case management hours. So the first quarter of the year, which ends up being pretty much the last quarter of HEAP, we had 146 applications. For the season of HEAP, though, we processed 538. That doesn't include the people that we helped with our unmet needs money. So we've been able to help, not as many as we thought, but we've helped a couple people get new furnaces, new boilers. We've done a few fuel fill ups. So that money
Tough
was,
winter for heat.
yeah, it was a very tough winter, very tough winter. And then NICEAG bills are
I was gonna ask, you don't have any money for that. do you?
perhaps.
You asking for your own personal use?
You don't wanna know.
Right there.
Everybody.
We get the most calls about that, about NICEAG. Karen Share, though, opened up one more time just for this week, which was a little bizarre. But so we've been able to, you know, people are calling if they have National Grid, help them with that.
All right, any questions for Kate?
Great, save them for next month.
That's
Write them down.
Thank you very much.
Thank you.
Great job.
$3,400 from Old Town Hall.
Yes, Terry, almost what is February.
Probably,
Wait.
probably 3.
Over 16 grand.
Oh, yeah.
That
When they used to have silo motors.
Yeah.
And now you have a full silo. Okay, wait, I digress. We still have business. Anything from the committee? Anything from the public? There being none, I'm gonna ask for a motion to
Motion
adjourn.
to adjourn.
Second,
Second.
all in favor?
Aye.
Opposed? Thank you, everyone.
Okay, I'd like to call the April Public Safety Committee meeting to order, please. Probation.
Good evening. Good evening.
Good evening.
Hope you guys had time to review the report.
From last
I'm
month.
here to answer any questions you might have.
Very well put together.
There you go. Well, thank you.
Motion to accept the 2025 annual report.
So moved.
Second. All in favor?
Aye.
Opposed? So carried. Thank you. Emergency management.
I don't have much either. We submitted our annual report. If there's any questions, or we can talk about it next month, having a chance to look at it. Also, I talked to the supervisor from Favre. We attended a drill, shelter drill at the Churchtown Firehouse, ex-firehouse, this weekend, and it went very well. Red Cross was there. They had some volunteers from their organization, the community support organization. They tell us that they are a new nonprofit, and they file with the state, and the Red Cross has verified that they are now accepted as a Red Cross shelter, which will be good for that whole area because, you're probably going to want a shelter 5 or even 10 miles away from where the actual disaster is, or whatever it is. So, other than that, any questions?
Question.
Yes, sir.
So, two things. One is on that, will the towns get a list of where all the shelters are?
We have a list. I can give it to you if you want. Yeah, we have a list of where they all are, and there are lists associated with the hazard mitigation plan that everybody did. Now, the list, we have no full-time shelter, per se. So, like all the schools are shelters, but if they have something going on or construction or whatever, they may not be able to do it when we need them. So we go to other places. I know, you guys have that community center you're working on. I know Lebanon has a community center they're working on. I don't know if that's certified as a Red Cross shelter yet, but we go to the Red Cross because they do it nationally. The federal government, has a partnership with them to do it nationally. We have a formal agreement with them. So if we need a shelter, we call them. They've already issued a trailer, an emergency shelter trailer at our location. It has 100 cots. So we would go take it to wherever the shelter is, and their volunteers would meet us there, and they take over because there's a lot to it. Medications, vetting people, the whole thing. They have it down. They do it in the biggest disasters there are.
Then they take control.
They do everything. So in that situation, if there's a shelter, for example, set up in Churchtown, which is good too, because they don't have a lot of other stuff other than the meals that are made there every day. If there's one set up there, we would take our trailer there. They would have volunteers go there, and the Red Cross runs it. And any volunteers from their organization would be under the oversight of the Red Cross once they activate one of their shelters.
So another question, is there any other shelters besides Red Cross? I know there's warming centers, sometimes the firehouse in Warrington. And the reason I'm asking, I got a call from the Club of Life, they had a generator, and they want to know if they can be put on a list for a warming or some type of center, that they have a room for.
Good luck with that. We tried to get the Germantown school.
And I don't know if we need to be Red Cross.
So there is supposedly with this new hazard mitigation grant program, the towns, which you could apply on their behalf, or they could apply. You'd have to go through your portal.
Okay.
But all the libraries have an agreement with the Department of Health, who we work with, their emergency preparedness, to open as warming and cooling centers. People can go in there. Any library in Columbia County, Dutchess County does it as well, and during business hours, warm up or cool down. They've all agreed to do that. Getting a generator is another whole thing. Since 5 years ago, we've been telling the federal government and the state these places need generators. And, unless you were a 24-hour shelter or emergency services agency or something like that, you really couldn't get any funding. Now supposedly they're easing up on that.
Yeah, we got them a generator. That's what they're asking.
Oh.
What's their next step? They already have a generator. They already have a big.
They're already, as far as warming and
Get the
cooling,
warming center, they're already there.
the only thing
Like
you have
you
to
tell
do is email us.
Mhm.
We keep a list
Okay,
that the state goes to also. During an event, during whatever's going on, we keep a list of all the warming or cooling centers that are active and the times that they're active. We don't reach out and say, hey, we want that library to open because we don't know their staffing.
right.
We don't know what hours, what hours they are that day or the next day.
Gotcha.
But like Churchtown, they called us the last warming center, the last one of the storms. So why aren't we on the list? You have to make that decision yourself and open and let us know. We'll support it however we can, but
Got
we're
it.
not going to call you because we don't know.
Yeah, you don't know, you got enough staff, you don't know. if
We
anything.
want you to do it. And the towns also, they open, I know a lot of towns here do, Chatham and all the towns do. During business hours is always good if you accept people. And to be honest with you, a lot of people don't go in and spend time in warming centers. They want to basically go in when the power's out to charge their devices. And so we don't really get a lot of people that go there and stuff. That's mainly what they want to do. But, if there's a wide scale power outage, most people will not go to a shelter. They want to stay home. They'll go to a warming center, make sure their stuff is charged. If it gets really cold, usually you can find a place. DSS has found places. We can find places. If we have to set up a shelter, we can do that.
Okay. That answers my question. That's it. I don't know.
Anything else, Ken?
Well,
That's fine.
no,
You always ask
I know, buddy. Hey, I get asked the question.
Right.
I got answers.
Yes.
Does the Red Cross designation unlock any other funding now that it wouldn't,
To be honest with you, probably not. It might, if they applied for, a hazard mitigation disaster grant funding for something, it might, not really, to be honest with you. There might be private though. You go to some of these private, like, the Kelly Foundation or, Berkshire Tonic, those places. And I found that it does make a difference in what they give you sometimes. If you're certified, you have to actually be accepted and certified as a Red Cross because it has to be ADA compliant.
Just an update on our supervisor's EMS financial work group. Couple of weeks ago, Governor Hochul passed there was a bill on her desk to be passed mandating that counties come up with a financial plan for providing EMS. Was passed into law a couple of weeks ago. There's supposed to be a template on the New York State Department of Health EMS website as to a formula and a guidelines as to what the counties need to submit. And that has to be submitted by the end of December. As you know, we already have an EMS plan here in Columbia County. We have a work group. That's part of the bill that was passed, and we're moving forward with that. I believe, to my knowledge, what we will be adding into that will be the cost of providing EMS coverage and some of the financial subsidies that are needed for these agencies. And that's one of the things that I think that they're looking at. It's like, how much will it cost if the state picks up some of the costs? Good luck with that. So anyway, the work group has been working diligently. We meet monthly. We'll meet again on Thursday. We actually had a discussion on the 2026 budgets that each agency submitted. We will be discussing that again on Thursday. It is kind of amazing in a way now. Again, these are budgets, okay? And you always try to plan for a budget so that it is neutral. But in their particular budgets, the combined
Net loss for all the agencies together is like over $15,000. One of the things that the supervisors in the group picked up on was that each agency really doesn't have a budget for future capital costs because they haven't been able to afford it. So I have reached out to the agencies and trying to get a 5-year projected capital cost requirements that they're looking at. So we can take a look at that as well to see if we can incorporate that into their funding. In addition to that, we continue to look on how to equalize the cost amongst the county. So the group is working diligently with the projection, hopefully to be able to put something in place for the 27 budget year. Secondly, you probably read, we had a horrific accident in Clover last week. That resulted in us deploying our Columbia County stress team to the Clover Fire Company. We had over 60 participants there from fire, police, EMS, 911 dispatchers, the sheriff's department. Went over very well. The whole purpose of this stress team is to help first responders emotionally and mentally, and to try to keep them in service. And if to watch individuals as well. And this is a continuing effort. We keep checking back with the chiefs and people in the departments to see if anybody needs any additional help moving forward. And we're there for them.
So about how many people was a kid?
Four.
Two of them is 2 years old, right?
2 of them are in Albany Med, and to my knowledge, they were in critical condition, but I believe they've been upgraded a little bit. Any questions?
PJ.
Yeah.
So question, I just noticed, and I get the calls all the time too, and I noticed we're getting a lot more helicopter called in. Is that a norm that they come to the scene now more than the ambulance is already there? I think. But they're, because of critical or whatever it is, to get them up to Albany for some reason, or is it?
Absolutely.
To
These
get them there
two
faster than-
patients were critical. One was transported by ground and the infant we transported by helicopter.
Right.
Okay.
But I'm saying, I see a lot of calls, no matter where the actions are around the county, I see helicopter inbound. So I'm saying, not that I know whether they're critical or not, but I mean, is it the norm now that we call in helicopters?
Yeah, it's been that way for a while. Understand that helicopters are called because we have EMTs, we have paramedics, and then we have the paramedics on the helicopter. They actually have another whole level of care that they can provide, including a lot more medications and, the critical.
Certified to do that.
Yes,
Okay.
yes. So that's part of the reason.
Okay, I'm just wondering.
Yep. Any other questions?
Thank you.
Thank you.
Thank
Mr. District Attorney. How are you, sir?
Good, how are you?
Good.
How about you? The report we just saw a minute ago reminded me that I promised to send you the report that I did for my office, and I haven't done that, so I sent myself an email to
remind yourself.
send you that. Yeah. So I have a resolution request for an agreement with the Vera Institute of Justice for a diversion program. This grant, or this program, is in collaboration with the Greater Hudson Promise Neighborhood, who would run the programmatic side of this pilot program. They get $70,000 from Vera Institute in order to help them administer the program. The district attorney's office does not receive any funding, so this is not a budget resolution for the district attorney's office. For us, it's a data sharing agreement. They're going to help us with our data to determine whether the program is effective or not. And so that's the resolution I have for you today.
So you're proposing you have a
I
contract?
do have a contract. I sent it along with this. The contract is here. You reminded me of something actually, which I ran this by the county attorney. He had one suggestion for additional language involving Vera indemnifying the county for any losses stemming from a data breach. And Vera said yes. They asked for one qualification to that, which I think is reasonable, which is the word reasonable to be inserted as far as the losses are concerned. So with those changes, I'm requesting that the contract be approved.
Second.
Second.
I guess my only question is,
Yeah.
will you have a contract with Promise?
With
Promise Neighborhood?
Promise, it's a three-way contract.
Okay.
It's a, yes, their obligation. And also, you know, although this is, I should say it's a 5-year contract, it's terminable by any party within 30 days. So if this doesn't work, then we can bail from it if we need to. It doesn't lock us in anything.
We have a first and a second, all in favor? Opposed? So carry. Thank you, sir.
Any other questions before I go? Yes, sir.
Can I talk to you after?
Of course.
Down here?
Of course.
Yeah.
Thank you.
That was easy. That was easy. That was easy.
I'm ready, board.
Let's do it with all the rest of them. You done 10 minutes?
We get some friends. We gotta get some friends. Any questions from the public? Any questions from the committee? I'll entertain a motion to adjourn.
Those are adjourned. Second.
All